My name is Shawdelle. I'm a children's nurse working in South London. I decided to get into this role after being a healthcare assistant at another hospital in a children's ward. I was in that role for about 2 years and wanted to do a lot more in my role because I really enjoyed what I was doing, but you're quite limited as a healthcare assistant in terms of patient care. So after talking to some of the nurses on my ward and management, I decided to look into going into a nursing career, doing my degree. Once I had a talk with a few of them, I decided I'll go for it. It was my second degree, so I wasn't sure if I wanted to do another one, but I went for it in the end, just because I knew there would be like an end goal at the end. Like once you qualify, you know there's a job at the end. You don't have to really worry in a sense. You just have to choose where you want to work and pass your interviews. So I applied and I went to Oxford Brookes. So moving from London to Oxford was a big challenge for me as well. I've always been in London, moved in and around London, but haven't been outside. So I decided to take, a step out and do my degree somewhere else, which was really good actually. I really enjoyed being out of London and seeing something very different, lots of greenery, a different scene, and just doing something a bit different. So I did my degree over 2 years instead of 3. I was able to fast track because I had experience already with children and with the background of being a healthcare assistant, that they took that into consideration. So I was able to do a 2-year degree instead of 3. So I started in second year with the cohort that was already there. So that was different, not starting from the beginning with everybody else. Everyone had made friendships and things like that. So just finding where you fit in. I was also a mature student as well, so just finding my fit as starting in second year, but also being a mature student, so finding like-minded people or people that were on a similar path to me, which I was able to do. It wasn't that difficult actually, despite all my anxieties about starting. So I did that, and then once I qualified, which was last year, it was very different with everything that was going on, the pandemic and how things had to change. My final placement was actually right at the beginning of COVID and the pandemic, so it was a whole different playing field all around. So working in that time, nobody's ever experienced it before, so we're kind of like a new breed, if you will. Qualifying and starting in the middle of something that no one's seen before. So that was good. We got paid to do that, which was a plus. My course didn't get the funding, unfortunately, so that was kind of like a perk towards the end, that we could do our placement as paid workers, working as a band 4, which is the band just below a qualified nurse, because when you hit third year, you're quite independent. They want you to be autonomous, take your own patients, because that's what you build up to. So you're working at a nurse level by that point anyway, so it was nice to be paid for it. Hopefully that's something that they can bring in the future. Looking forward to seeing how we can push that forward for student nurses, because you're doing shift work as nurses would from first, second and third year. So, if we can get some sort of incentive or bonus alongside it, that would be great. So I've been talking to a few people about how we might make that happen. Aside from that, starting after qualifying and starting in nursing, which I started in November. Again, still lots of changes going on back and forth with how they're managing hospitals. We're still in the middle of the pandemic, so that was something new as well. We had lots of moving around, lots of adjustment, which is very different to how you would normally start as a newly qualified nurse. Normally you pick your ward and you settle in for, 6 months to a year. But this time around there was, closures of wards and things like that. So the ward I was on got closed just to make room for other patients that might need it. So there was some moving around for us in the first 6 months. So I kind of got to work kind of everywhere, which was good for experience, but also kind of scary, but more good for the experience. So I got to work with adults for a while. I got to work with really tiny babies in NICU, and also my normal age range group, which is kind of 0 to 16, sometimes 0 to 17, depending on their background and why they might need to be with us for a bit longer. So I've had quite a big range over the last 6 months, learning how the different departments work. My greatest challenge has been just adapting to this new world. So when I started, it was weird saying, hello, my name is Shawdelle, I'm your nurse. Just that leap from a student to a nurse is quite challenging, remembering that you are now taking patients, you're your own person and you have to assert yourself in that right. You did your qualification, you need to own it. So that's quite a challenge, just trying to find your feet. You feel kind of like you need to know everything, which you don't. One big thing you realize is that nobody has the answers to everything, so don't be too hard on yourself. And just, finding your confidence in what you've learned as a student and what you've put in practice as a student and putting it forward in real life once you become a qualified nurse. So just that whole rounding of things was quite a challenge, but you get through it. I'd say if you're interested in nursing, whether you've always wanted to do it or whether it kind of sprung on you like I did, I would say go for it. Just speak to people around you if you're in that field, if you know any nurses, or if you're working in healthcare and you're interested, just talk to people about what you have to do, what the course is like, and your opportunities at the end of the course, just to see if it fits for you. But it is a very rewarding job if that's something that you really want to do. If you're interested in, seeing patients from when they're coming quite poorly and be able to see them through to the end when they get discharged home and you see their process. If you enjoy just the nurturing side of caring for people, especially in children's nursing, it's not just about the child, it's about the parents as well. So it's family care. So sometimes the child might be fine, but you're, providing reassurance and care for the parents just to let them know that things are okay. So if you're into any of that and that's something you feel like you really want to do, I'd say go for it. Yeah, it's a really rewarding job, but it is hard work. So just be prepared for the real life.